Welcome to this video on doctors' professional relationships. We will explore the essential principles of professionalism, focusing on ethical relationships with patients, colleagues, and the broader healthcare community. The first scenario examines a senior doctor's approach during rounds. Let's start the action. Dr. Ahmed, a senior surgeon, is conducting his rounds in the hospital. He asks junior resident Dr. Sarah to examine an elderly male patient who recently had surgery. Dr. Ahmed speaks loudly, dismissing Dr. Sarah's attempt to pull the privacy curtain, leaving the patient visibly uncomfortable. Dr. Ahmed insists that there's nothing to be embarrassed about in a teaching hospital. He frequently uses dismissive language toward residents and other healthcare professionals. He keeps calling the nurse and physiotherapist paramedics instead of their actual titles, which makes their roles seem less important. While Dr. Sarah writes her notes, she replays the patient's discomfort and Dr. Ahmed's actions, uncertain about how to balance her duties. She later discusses the incident with her colleagues, seeking advice on how to address these ethical and professional issues while respecting her role as a junior doctor. Now, it's your turn. Grab your popcorn and get ready to dive into the questions. Question 1. What ethical concerns are raised by Dr. Ahmed's approach in this case? Question 2. How could Dr. Sarah have handled this situation to advocate for patient privacy while respecting her senior's instructions? Question 3. What are the possible consequences of Dr. Ahmed's treatment of the nurse and physiotherapist? Question 4. What steps can Dr. Sarah take if she experiences similar situations in the future, where patient rights and professional relationships are compromised? Question 5. How does this scenario highlight the importance of professionalism in doctors' relationships with patients and colleagues? With the tension still fresh from the hospital rounds, the story shifts to the surgical theater. Dr. Essam, a skilled surgeon with over a decade at the hospital, has earned a reputation for his expertise with traditional open surgery. Enter Dr. Noah, a younger, equally skilled surgeon advocating for laparoscopic surgery. The two surgeons meet in the operating room, as Dr. Noah shares his approach with a group of junior doctors. Unlike Dr. Essam, Dr. Noah champions minimally invasive techniques, citing faster recovery times and shorter hospital stays as major advantages. Dr. Essam shakes his head, interrupting, "That's not how things are done here. The open method is tried and true." Dr. Essam and Dr. Noah's rivalry escalates as they openly criticize each other's methods in front of staff, causing confusion and discomfort. Junior doctors struggle to decide which approach to follow, while the team's morale declines, affecting the hospital's reputation. The hospital administration intervenes, calling a meeting to address the conflict. Let's scrub in as we dive into the questions that this scenario raises about professionalism, teamwork, and conflict resolution in a medical setting. Question 6. What ethical principles should guide Dr. Essam and Dr. Noah in their conflict over surgical methods? Question 7. What steps could Dr. Essam and Dr. Noah take to resolve their conflict? Question 8. How can the hospital support a positive environment despite the conflict? Question 9. Why is professionalism crucial in resolving conflicts like this? Both cases highlight that professionalism, rooted in respect, empathy, and collaboration, is essential in healthcare. It strengthens patient care, teamwork, and trust. Reflect on these principles and refer to the book to keep professionalism at the core of your practice. Thank you for watching. The end.